T.
I don't know why. Maybe it's because my family is spread out all over the country, but around this time of year, I start thinking about how to gift myself. And that's when I think about my good friend, Dr. Mark Beaty, the CEO and head and facial plastic surgeon at Beaty Facial Plastic Surgery, because, I like to look my best, and he helps me. So welcome.
Oh,
welcome
hi, Dana.
back.
Hi, Dana. Thanks.
Beaty.
Glad to be here.
I do. This is the time of year you get a little downtime over Christmas. You're like,
Yep.
you know what? I need a little freshen up. I need a little. You guys get busy over the holidays, don't you?
We do. Yeah. I mean, it's for the exact reason that you said. People have a little bit of downtime, and whether that's big things, little things, whatever, it's a convenient time to come in and do some little touch-ups.
Yeah, you have to have your Christmas the week before or something, or you have to have Christmas in January when everybody's gone back to work.
You got it.
All right. So listen, before we get to some of the things people might want to do,
Yeah.
you're just back from China, yes?
Yeah.
How was that?
So long trip, but really, really awesome. First time I had been to China, first time I had been to the Far East, and I was invited to go over and help with the relaunch of one of the technologies we use, cool sculpting, for body contouring. This was an entire relaunch for China, so a couple of days in Shanghai, a couple of days in Beijing with big production events. It was really quite interesting.
It's so interesting because we're obviously China's been in the news quite a bit, and we hear all of the drama. But then I hear about you doing something like that, and it sounds like China is very commercialized. I mean, if they're thinking about, freshening up with cool sculpting or losing a little,
Yep.
stuff around the middle or whatever, I mean, that seems kind of American-ish, no?
Yeah, well, I think you have to understand this. Just think about the scale of everything that's going on in China, and so they have this rising, burgeoning upper middle class, and yeah, they're interested in taking care of themselves in much the same way that we are.
Makes sense.
So there's no question that the market is there, and it was really, really quite enlightening to go and talk to their doctors, their administrators, their potential patients, and you're right, it's not tremendously different in what people's wants and desires are.
Yeah, I think that is, in a weird way, that sort of humanizes the Chinese for me, because I feel like when we're talking about these news stories, we just say China like it's all one person. And there's one personality, and it's the personality of the leader, and that's kind of it.
Yeah.
And that's obviously not the case, as you were. And also, I'm just glad that you're back and you did not cause any kind of international incident, because, that would have been awkward.
Yeah, it would. Yes, indeed.
Yes. So you made it back in one piece. Excellent. So are they as up in China on all of the different kinds of treatments, or are they a little bit behind, or where are they on all of that?
It's different. I think overall the technology base is pretty similar. So, they use lasers, they're introducing cool sculpting, their surgical techniques, maybe a little bit behind what we're doing, but not dramatically so. Probably the most interesting difference is that all of the aesthetic clinics in China, at least everywhere that I went, which admittedly is Shanghai and Beijing, so, large urban centers, but they're huge. I mean, most of our practices in the U.S. are relatively small scale, and these places literally, many of them are like small hospitals.
Wow!
So the concentration is a bit different in how they deliver the care.
Interesting.
Yeah.
All right, let's come back stateside.
Yeah.
Dr. Mark Beaty hanging out with me from Beaty Facial Plastic Surgery. And, at the beginning of the segment, I was mentioning that this is the time of year a lot of people like to freshen up a bit.
Right.
And in the notes that I have for our conversation today, there's a new treatment I never heard of before. And, I don't like to be behind the curve here. It's called Profound. So what is this?
Yeah, so Profound is a radio frequency technology that we've been using now for about 2 years. The way that it works is that the radio frequency energy is introduced into the dermis of the skin through tiny little microneedles. And its primary use is as a skin tightener. So if you have somebody, say, that is beyond the from the standpoint of skin looseness in the face or on the body for that matter, that's beyond the ability to treat with office procedures like microneedling and microneedling and things like that. But they're not quite ready for surgery. This is that bridge procedure.
Interesting.
Provides quite a bit of skin tightening for us. The most common thing is for lower face and neck. It's getting just a little bit saggy, but you're not at the point where you need a surgical procedure. This is the perfect intermediary.
All right, so now we're doing full disclosure moment. So because I just like to share everything with my audience. But so you and I, we did a procedure on me,
Right.
But it was different. It was similar?
Correct. So that also was a radio frequency technology. That you could consider maybe a step back from this procedure.
So this one's a little more intense than the one I did.
Correct.
Okay, it's a little further along maybe.
That is correct.
Okay.
Yeah, that's exactly right.
All right, because the next step is I'm just going to freeze myself in place, like so I don't move and I don't get any new wrinkles or whatever. So with all of these kinds of things, I know the question people always have, Dr. Beaty, is, does this mean I don't have to have a facelift later? Does it hold it off a certain number of years? What can people expect?
Yeah, so I think that most of the non-invasive or non-surgical technologies that we use, they're real and lasting effects, but they're to a lesser degree than what we can accomplish with surgery.
Sure.
So, for example, profound, I think, in most of our patients with a little loose lower face and neck skin, that's going to give you a reset of maybe 2 to 3 years.
Okay.
Of improvement in appearance.
Good.
So if you then extrapolate from that you're probably gonna continue aging at about the same rate, you get back to the baseline in about 3 years.
Now, is it the kind of thing you
decent.
could do again 3 years later, or generally by that point you're maybe ready for the facelift?
Depends on the person.
Okay.
So the answer, can you do it? Absolutely, and that's important. So this is a technology where you can have repeat treatments, and there's no problem with that.
Sure.
I've also operated on people who have had this treatment before, and there's no problem with that. So it's an expansion of our options.
Okay,
it really
like that.
is.
Yeah. And is that something you could do, for example, over the Christmas break? Do you recover quickly from it?
Absolutely.
Okay.
So generally, people feel fine after this. The next day, you're going to feel fine. Most everybody gets some bruising. So advice, I tell folks to anticipate 4 or 5 days of downtime, but simply because of bruising.
Yeah, so you could go out and about if you don't mind people looking, seeing you looking a little.
Yeah,
or you
could, honestly, you can usually manage it with makeup because the bruising is fairly light. So, it's a minimal downtime.
There's where we have one advantage, the women, because the
Absolutely.
guys don't really wear makeup. So, but men and women can do this, yeah?
Yeah, and actually that's an interesting point about this procedure. One of the concerns when we first started using this is, is this going to work all that well in men because we have heavier skin, it's beard-bearing, it's different.
Sure.
Results in men have been great. So, it goes both ways.
Yeah, and men are liking, it seems to me, I mean, you can confirm, but I feel like men are liking, the same kinds of treatments now, too. I mean, they're wanting to look younger and fresher and all that stuff as well.
Yeah, I think in most of our practices, we're seeing a significant increase in men that are looking for aging face help.
Yeah.
And I'd say in my practice, it's probably gone from maybe 5% 15 years ago to 25% of the practice now.
That's significant.
And
Yeah, for sure. All right, listen, Dr. Beaty, before I let you go, anything we need to tell people about coming up on the holidays? Any special deals or anything like that?
So the coolest thing that can be considered for holidays is we've started a program going into next year that's called Beauty by Beaty, and what it will allow you to do is let us help design a program for you, whatever that may be, and it can be applied on a subscription basis.
Oh.
So rather than, let's say you need something that's a little bit more and you don't really, that's just not in the budget to spend at one time. We now have a way that we can amortize that over the course of a year, and it works, kind of more like your Netflix account. kind of,
So you kind
we
of
come up with a plan. This is what your needs are, and then we can do it on a subscription basis through the year, which has been super cool, really popular.
So
and
I love
something-
that. So that's like,
Yeah.
so if you need your Botox and some filler, and then maybe you also want to do a profound, or maybe towards the end of the year you'll be doing something more, dramatic, a more intense procedure. You just sort of figure it all out in one plan and come up with a monthly.
Correct.
I love that.
Correct. Yep.
You're always thinking, Dr. Beaty. I love that.
Yes.
Listen, always great to see you. I really appreciate it. And of course, we'll post a link to all things Beaty Facial Plastic Surgery. Happy holidays, my
Fabulous.
friend.
Thank you